And we would like to listen to Dr. Scholtissek. She is a veterinarian and naturopathist, but would like to enter into veterinary medicine. Would like to have explained how veterinary medicine and bioresonance, according to Paul Schmidt, how it works. So, Hermes, well, in the end, I was absolutely delighted that in the Third World Congress, we also have a veterinary part, because if I think how many users we already have from veterinary medicine, whether they are veterinarians or animal naturopathists, or if they have naturopathy basics for treating the animals, this has increased even more than in human medicine. But just think, when we had this clinical perspective, double-blind randomized study, we still didn't have it. Veterinary medicine was very important because we could say, okay, a horse, a well-treated horse, a well-treated dog, could not just imagine this success. And this was the proof of concept, and that our procedure had no placebo effect. So you can see how nicely animals reacted. It was even great. Now we have both of it. We have the study and we have the nice experiences in veterinary medicine. So I'm really delighted of having the presentation by Dr. Scholtissek.
Liebe Zuhörer, hier aus Lünnestadt begrüße ich Sie auch ganz herzlich zum 3. Weltkongress der Bioresonanz.
Dear audience, welcome to the 3rd World Congress about bioresonance, according to Paul Schmidt. Thank you very much, Dr. Heinus and Mrs. Bunkburg, for the introduction. She has mentioned the title already. I'm going to talk about the pain treatment with bioresonance, according to Paul Schmidt, in veterinary medicine. This morning, the basic principles of pain has already been discussed in human beings. So I'm not going to repeat anything about the pain cascade. Human beings and animals, mammals, are mammals, and therefore the mechanism is comparable. First of all, I'd like to give you an overview about my chapters. I'm going to talk about the perception of pain first, about diagnostics. Third thing, the diagnosis with dogs and cats. What is particular in a veterinary praxis? What are the concrete examples? And the most important part, bioresonance according to Paul Schmidt. Well, what does pain mean? It means an unfortunate emotion, an emotional negative feeling. It can be very severe. It can be torture. It leads to limited living quality. Animals can't help themselves, and the owners feel helpless in such a situation. At any rate, there is an emergency veterinary care which is available 24 hours, 7 days a week in all of Germany and in other European countries. So you just phone your vet. If he is not available, you will be transferred to another available doctor. If there is any a suspicion about pain among an animal, the owner should react immediately and wait whether the symptoms may get stronger. They could be dangerous. If animals can't anymore, they show their pains, and they probably have a long way of pain behind them. So the emergency service is always available, as mentioned previously. First of all, as animal owners, you could think about taking painkillers from your own box, but this won't erase the causes. And of course, many painkillers for human beings are not good for animals because they may be poisonous. For example, aspirin is very bad for cats. They don't have the possibility to get over so just one pill of 500 milligram could kill a cat. And many of the human painkillers do already contain paracetamol or caffeine, and these are also medications which we should be careful with when giving it to animals. All painkillers have also negative consequences on your digestive system. Well, the perception of pain is important for the owner of the animal and the vet. It usually is difficult because we can't ask the animals, because animals can't say anything verbally and they can't tell us where they feel pain. We just have to look, we have to observe them. Pain of whatever kind leads to a change in behavior, flight or fight, or just lying on the floor, or sometimes there are some strange movements that when you stroke the animal would react negatively. Sometimes these animals are restless. So these, as vet, you have to be like a detective, and you have to observe them very carefully. What do you think about this photo on the left-hand side? Does this animal have pain? Because the tail is hanging low, and also the eyes are very sad. What's the diagnosis? In practice, we hear the report of the animal owner, the pet owner, and then we observe the animal in the clinic. Then we start a palpation at the for the front and ears and eyes. Then we palpate along the lower abdomen, and we try to find where the pain may come from. Apart from that, in veterinary medicine, we have, of course, also X-rays, CT, MRT, and also lab analysis. So we can carry out all sorts of different kinds of histological or other analysis. And then the very important point is the bioresonance according to Paul Schmidt, because it's very neutral, it's absolutely neutral. The appliance would only tell us something, so we don't have to interpret anything. What is the behavior analysis? We look at whether the animal is being looked after, and about the fooding habit. Does the patient still have appetite? Can he swallow any food, he or she? Is there any change in the posture of the animal, in the expression of the faces? Are there any other changes in behavior? Is there a strong need for rest or sleep? Or maybe the dog won't jump into the boots of the car, or the cat won't jump on the table or on the windows. Of course, animals have good days and bad days, and they are also susceptible to weather. What is the most important area of bioresonance, according to Paul Schmidt, with cats and dogs? First of all, allergies. They have a high importance, such as it can be washing powder or any children's toys, or pilgrim phosphanol A, which you can find in the inside of the food, the cat food tins. We also have funguses, bacteria, parasites, and viruses. Leishmaniose, babiose, ehrlichiosis, borreliosis are example of this. They are not taken seriously by the orthodox medicine, so we are ahead. And then we have chronic diarrhea in vet medicine. Animals may have had years or months of bloating and diarrhea. The causes can be fungus, bacteria, or also a lack of certain minerals and vitamins. Epilepsy is also a topic in vet medicine. Many pet owners are hesitant when it comes to giving anti-epileptica to pets because it makes them very quiet. So animal owners look at different solutions. There's also an allergy against the saliva of fleas, and the incompatibility with certain foods are very frequent. There is a high array of different allergies. Pet food contains not only beef, but we have kangaroo, buffalo, rabbits, trout, and salmon. Now, the pet owners start from their own feeding or food habit, and they want to offer a variety of foods to their pets. And the industry takes that advantage of that. So they give us a picture of a certain pet, and it says lamb from New Zealand, or Italian menu, or herbs from the Provence, which the owners, which makes the owners buy this kind of a tin. But susceptible animal patients may be, it may be too much for them because their flora has to adapt to these new sources of proteins. And this is why they do get chronic diarrheas. Many of the diseases among animals is also when they scratch themselves, of course. We also have dermitis or psychosocial problems, which can be treated with bioresonance. Psychosocial problems appear mainly among cats. The pet owners they think if they are at work for the whole day and the cat is on its own for the whole day, so they think, well, maybe it's a good idea to get other cats in the house. But then the hierarchy in the cat society is uncertain, and it can happen that one cat is superior and the other one is inferior, and it will finish by tearing its own hair out. So they look like lions, and they are still only have the hair among their heads where they don't reach with their tongues. Then there are other cases in which cats the cats actually mark their territory with urine. So they have their stomachs get too sour. We have a new partner in the family. The cat used to be the main animal, but now it has been degraded to a second or third level. So what they do, they would suddenly defecate on the pet owner's clothes. So this is the reason that pet owners would finally end up at the bioresonance clinic. It also leads to an over-souring, acidification because of the stress. Now, some conspicuous behavior also appears among dogs. In the clinic, we had the example of a young dog. Now, the owner wanted to train it as a hunting dog, but the dog didn't have any interest whatsoever. Then the pet owner insulted the dog as a lazy dog, and we looked after the dog and carried out bioresonance and realized that the patient, the dog, did have a serious heart issue, and therefore it is so lazy. With using the bioresonance therapy and the heart medication, it could be treated successfully. This is a case from our beginning, and Cliff did get 15 years old. I can show you a few examples. Now, the food allergies on the left here, there is a female dog from the emergency services in March. Yo-Yo used to be at a vet's, and therefore here we have a cut fur. but she had serious scratching problems and bleeding on her whole body. The owner wanted to do something special, and she got a special herb mixture which she gave to the dog. The owner already knew Bioresonance, so we carried out the dog immediately, and we realized that the dog, because of that herb issues, had some symptoms of poisoning. Afterwards, we did treat the dog twice a week, and it looks like on the right-hand side, so much improved. So this again was a fast success, because otherwise you would have used cortisone and you would have had to treat it for much longer. Another area is inflammation of the ears among dogs and cats. Very frequent, because here we have the different reasons. Sometimes it's allergies, sometimes it's foreign bodies, or in this case, the fact that the animals scratch themselves too much, and the ears will get red and they smell badly. Before starting with bioresonance, the ears have to be cleansed. In the middle of the picture, you see the cleansing material which we use, and here you have all the fungus, and we use them all for the desensitization. First of all, the identification of the pathogen, and eventually we got a clear improvement. Another example is leishmanosia among dogs, which is a very well-known traveling disease. Leishmanosia is transferred and contaminated by mosquitoes. It's a traveling disease. These stings will transfer the macrophages, and like Mycenia will then expand, and there's also a zooanthroponosis, which means it can be transferred to human beings. We have two different forms. We have the form on the skin, cutaneous disease. Nose and ear will be affected, or ears, or also that the feet will be infected. This dog, named Otto, came from Spain. He was highly infected. He had a visceral form of leishmanosia, and he had diarrhea full of blood, and the swollen lymph nodes, and then we had bleedings from all different openings of the body. Now, we had Otto for about 3 times a week at the beginning. He got alomoricurol, and he got an antibioticum, and he got a protein-poor diet. But in the course of 8 weeks, we could stabilize the dog so that the leishmanosia did not increase anymore, and he got nearly cured. Now, we also have some objectives in the therapy. The improvement of the living quality by litigating the pain. We want to make sure that any functional disturbances will be prevented, and the progress of the disease should be stopped, or it should be broken down. We want to slow down any aging process. We want to make sure that medication is given in low doses without any side effects, and the usual the owner and the pet should go back home healthy and happily. So there is a kind of a symbiosis between the pet owner and the pet, a very strong symbiosis. In particular, when it comes to a cat owner, a visit to the pet is an adrenaline shot, because the fear of the owner will be transferred to the cat. First of all, you have to catch the cat. Cats don't like to be caught and to be put in a box. And they sometimes may defend themselves, and they may let urine, or there may be some blood. Then it may be bleeding. Then the cat will be stored in a box, and then the cat has to be transferred by car. Everything shakes and vibrates, and the poor cat is full of fear. Then the cat will finally be taken into the clinic of a vet. It will be confronted with unusual many smells and sounds, and it's very much intimidated. In order to make a sensible diagnosis at this point of time is very difficult. Then a cat has to be given to an assistant who disinfects the cat in order to make sure that it can be examined. The best thing would be to do everything just in one room in order to reduce any stress. Now, as far as dogs are concerned, now those sweet small dogs, this is their first visit at the vets. They are quite with no any expectations, not biased, and friendly and curious and peaceful. So they are perfect patients so far.
So. Der gesunde Hund oder
now, a healthy dog at the vets. A healthy dog would shake himself up to 4 times a second from the head to the tail. It's like a wave. You can see it on the picture on the left-hand side. This is a dog which has just come out of the water and wants to get rid of the water, and then you have this wave movement. If that is not possible, then something's wrong with the dog. Dogs are quite cooperative when it comes to getting a blood pressure, a blood analysis. And of course, the pet owner has an influence on the pet, so many go to a dog school, and therefore the treatment of dogs has become easier in the course of time. And then there is the bioresonance, according to Paul Schmidt, which is quite well accepted. And when it comes to the harmonization process, the dogs will lie and sleep and snore, and maybe the pet owners as well. Now, the recognition of pain among dogs. Most dogs show pain and disease symptoms only if they are really, really badly off. Now, which symptoms of pain a dog shows depends on its character and the personal limit of pain. Dogs don't hide their pain, but a change to behavior has its reason. Now, this French bulldog Bailey suffers from tremendously, as you can see on his or her face. It does have intense pains and shrinking of muscles. Now, the pain recognition among dogs, acute symptoms are when sharp dog barking, weeping, crying, trembling, shaking, or they have a strange back because this dog has intense belly pains, or we can see that the veins can be seen. Sometimes you can hear that dogs give strange sounds, or they would lick off things in order to get the pain out of their parts of body which are affected by it. Now let's come to talk about the cats. Now the cats are seized. Cats are still curious when it comes to the first visit at the vets, so they are looking quite curiously and interesting into the camera. So these are our easiest patients, but in the course of their lives, this won't stay that way. Cats are cats, and cats do whatever they want to do. And in this field of tension between easygoing patients and very nasty patients, we have to move as vets. Basically speaking, we can say that many cats are difficult to handle, in particular when it comes to giving them medication, for the pet owner at home even more so, but also for us in the clinic. The cats don't want to be fixated and be giving anything by force. Cats are fast and they want to escape. And of course, their teeth and their nails are sharp. And when it comes to getting their blood for an analysis, you have to make sure that you get their bloods and not the blood of the vet, because you can cut yourself. Very often, pet owners are afraid of their cat if it gets angry. And here is the hour of bioresonance, because it has the main advantage that the animals don't have to be touched at all. And the diagnosis of the cat and the therapy of the cat can happen in the wherever the cat is sitting, in its own little bed. Pain recognition among cats. Cats try to hide their illnesses as long as possible. They are compensation artists. Cats hunt on their own, and they manage that way. Hunters would never show a weakness. It's a quiet suffering which they put up with for a long time. So an objective evaluation is very difficult. Cats mews or scream only if they have very highly acute pain. One example is a thrombosis of the aorta. This is a very serious scream, so you don't need any further diagnosis. Now, screaming at night among cats can in particular appear when they can't hear at old age. Psychological parameters are not really very useful for cats suffering at high age. Endorphins or cortisols can also be released when it comes to stress or fear. Feline grimace scale, because pain can be expressed among the face. This morning, Dr. Voss already spoke about the NDI, and it reminded me that in the vet medicine, we also have a scale according to which we can measure pain among pets. And the investigation, Paul Schmidt from the University of Montreal used that fact, and he categorized 5 different feline grimaces. So we can make a judgment on the degree of pain. It depends on the posture of the head, the eyes, the ears, and the mouth. And then there is an action unit of a scale of 0 to 2. The 0 means that the animals are healthy, 1 that they have some weak pain, and 2 strong pains. Now, if you have a look at these 5 parameters, we have the maximum pain score. It will be 10, and among the orthodox medicine, it says that everything higher as 4, that animals should be treated with painkiller medication. Now let's have a look at the pictures on the left-hand side. This is the head posture of the head. The cat does have its head among the back, so it doesn't have any pain. Or it has the head above the shoulders, which is fine as well. In the middle, however, you can see that the cat has some pain, mild pain, because the head is like on a medium posture. And when it comes to strong pain, the ears will be pointed upwards and the head will be downwards or even touch the floor. Then we also have the position of the beard hairs. They may either be going downwards loosely which will be fine, so they have no pains. But if they point upwards, spread into different directions, and then the cat feels pain. On the right-hand side, you have a detension of the mouth muscles. Usually the cat is relaxed. In the middle, it is mildly tense. And on the right-hand side, it is markedly present, elliptic form of tension. Then let's have a look at the eyes. On the left-hand side, you have the usually normal open eyes, no pain. In the middle, we have moderately present pain. And on the right-hand side, we have a markedly strong pain. And the last thing is also the position of the ears. So now, right diagonally upwards, no pain. Moderate pain means that the ears will be slightly going downwards, and if they are strongly going downwards, we're talking about strong pain. Then there is another pain model in veterinary medicine as an example, as far as the teeth are concerned. Toothache. Now, the cats have a high incidence of teeth diseases. On the left picture, you can see the red gungiver, and you can also see a toothstone, and this will appear especially when among so-called noble cats. So these are infections with herpes and Alicia. These tooth problems, you can imagine when you have a toothache yourselves, they can be quite severe. And the symptoms is a reduction in eating, and also the fur around the mouth may be affected, or a bad smell coming from the mouth. And we, as a pet owner, should realize that. Differential diagnosis, it can also be that they are badly fed. They can also get other viral issues, diseases such as feline problems such as peritonitis, feline peritonitis. And among dogs, we also have genetically conditioned diseases, pachycephalus, for example, and others.
Like the French bulldog or the boxer, the teeth are not placed well on each other, so they create plaque. In this case, you cannot start with bioresonance, because if it looks like in those pictures on the left side, you first need to extract one or several teeth, and if you start retiring plaque, you often have the whole tooth. So tooth extraction in such a case is not very difficult. Such tooth extractions hurt quite, and patients need to be given analgesics in order to be able to take in food, and also an antibiosis is necessary in the case of gingival disease. Usually they get cortisone preparates. But resonance also comes in here if they post-surgery, the healing of wounds and the reinforcement of immune system. This allows to reduce the amount of anesthetics, and the recovery of full anesthesia is possible. We do the tooth healing in the morning, and the patients keep in the box until the evening, and they can get their programs, and they return home quite fit in the evening. Then we have also stomach pains. We have visible changes, repeated change of position, curved back, or raised abdomen. When you make a palpation, you feel a tense abdomen. It could be either a gastrointestinal problematic with or vomiting, or also an alien body, intestinal constipation, rhinitis, stones, gallstones. Here you see a 19-year-old cat with many stones with recidive arteria, and from the lumbar, the transition from the lumbar spine to the coccyx had some doses, but it overcame it, and the owner is satisfied. What do we need therapeutically? We need to use drugs, usual clysters and suppositories, as in the case of constipation on the left arm. The cat is only 2 years old, but it had a massive metabolic disease. So we see the spondylosis, and this leads secondarily to this constipation. Because when cats sit down to secrete urine or feces, it had to do it, but this cat has such pain in the spine and the tail that it's impossible. It has a constipation. Sometimes an operation is necessary if it's not that acute. We can give them a diet with sugarroot if they have them running freely outside. You see them eating grass. This is the first protection reflex with grass or sauerkraut. They wrap what is not good for them in the gastrointestine. In this case, we have a bioresonance and bioresonance therapy with cats, guinea pigs, and rabbit is encourages urination and defecation. They already do in the box. And dogs, when they have done it, they stand up and they shake, and apparently the stiff pace is over. Then we have chronic pains as a visible change. We see a reduction of activity. We are in the vicious circle of less movement, muscle reduction at depositors. The pets don't jump anymore on the windowsill, the bed or the car. The symptoms are lameness, a unsafe pace, sometimes hanging head, or the tail is stiff, or they have when they bite, when they have some when we touch them at a painful place. It could be also arthrosis due to age or charge. Elder dogs, when they get up, they don't activate in the morning, but then they do it. That's also an idea that there is arthrosis and that they have pain. Spondylosis, I already mentioned. There are also issues with basic relation, osteoarthrosis, and degenerative joint diseases. They usually affect all joint structures and usually don't have any specific reference to lameness. It's rather behavioral changes, reduced body care, and the stiff fur, matted fur. You can see on the picture on the left a dog on the beach. It made a great video, which cannot be shown for technical reason, which is paralytic. The brown dog. It has a walking frame with a front, aiding with the front, and the front it's quite fit, friendly, and takes part in life. So the medical aids that also are used in human medicine have been introduced into veterinary medicine. Right, what therapeutical possibilities do we have with all I have mentioned so far? On the one side, it's drugs, analgesics, antibiotics, or cortisone, or we use bioresonance according to Paul Schmidt, and we have a very relaxed musculature, and pain is reduced quite quickly, and patients have more appetite. The mobility improves, and the life enjoyment is recovered. Attention is clearly improved. The owner of this dog told me that he's much more awake and much more balanced. The fur is growing again. It's it's shinier, and the dog has always warm feet. It hadn't had them for 5 years, so life quality has increased massively for the dog and its owner. I'm coming to procedure in our practice. First, the patient has to be taken where they are, and bioresonance is the last straw for many. They have spent big money, and based on this, we are under a massive pressure for success because the expectation of the owners is high. First, we allow the owners to tell the problems, and if there is no current result, we take a blood sample to see how the enzymatic changes in the organism have taken place, because in bioresonance testing, we have, for instance, sentences about heart, liver, kidney. The flow is stopped, and owners want to know how much. And based on figures, because many people only are able to tell figures, we say that the enzymes in the liver have increased twofold, threefold, etc. Usually we do bioresonance diagnose twice a week, and twice within a week interval, and then therapeutical program when it's very acute diseases when we need to act immediately. Then we do the therapy programs twice a week. In case of chronic problems, once a week. And we have routine checks based on sensitivity of the owners every 3 to 6 months. The procedure in practice in bioresonance, according to Paul Schmidt, we do the RAH, or they diagnose twice within a week's interval. We make a drug test. We check first existing drugs with which the owners have come to our practice, and then we look for new approaches, if necessary, in homeopathy or Schüssler salts, also Bach flowers. And we always make a food test with the new food test set of Ryonex. And then we have a therapy program, as mentioned, with acute disease twice a week, with chronic disease once a week. And there are more difficult patients who don't like, or the owners don't like to come into the practice, or they are too far away. We tell them, we order them home therapy with PS10, and on the green card they get the programs for take home. And then the routine checks every 3 to 6 months, depending on the financial possibilities of the owners, what they are ready to spend for their pets. The advantages of bioresonance, according to Paul Schmidt, in the veterinarian practice, they can be applied in all pets, whether large or small, a horse, dogs, cats and birds. We had still no snakes or mice, but you cannot still exclude it. It's absolutely painless. Cause-oriented diagnosis is possible. It's a completely holistic approach. It's well tolerated and is very well accepted. When animals come to my practice and they want bioresonance, they want to come into my treatment room, they go into the bioresonance room on the mat, and the cats jump into the basket where they get the harmonization program. With bioresonance, side effects of drugs can be compensated, and the psyche is also treated. The psyche is a very important factor because in veterinary medicine you cannot ask the patients where the aches and pains are. The owners have a subjective interpretation of what they mean the animal has, and very often we observe in the test that disorders in the flow between thalamus, hypothalamus, and the lymphatic systems is there, and the patients cannot adequately apply the impressions from the environment. So now comes the RAH scan vet, the quantum leap of bioresonance, according to Paul Schmidt, into the future. Recently, an ECG-based automatic test was introduced, and there's an automatic determination of the therapy program. This new approach, I think, is very valuable because we can create a high acceptance at the owner. An ECG is known to everybody, and a skeptical man will also be convinced that everything is realistic and scientifically based. And according to the presentations we've had this morning, I think we've reached this point. Teleton bioresonant, according to Paul Schmidt, does awfully well. Tamba is whispering it into Rika's ear. Thank you very much for your attention. I think this was really very, very interesting for all, and for many, perhaps a new insight, because you've really looked all around it, all corners. Dogs and cats is something where people have an idea how to apply bioresonance, but it was beautiful to see the difference between dogs and cats, aggressive or peaceful. We'll have also the role of the owner. We don't have the human area, but okay, with children and parents it's different, but here it's a different relationship. So very, very much. Thank you very much. We'd like to see whether questions have come in to the technical department. Yes, do we have any questions? Well, we have the first one, which says, you describe in the presentation that you are using bioresonance after Paul Schmidt with dogs and cats. Does it also work with animals, aggressive animals? Yes. In any case, of course, you need to come into our practice. That is the decisive factor. You don't need to touch them, you just it can be adapted with the mat to the device, and if the owners get the dog or the cat to get down and can be connected, there's no problem. The point is rather that the owner doesn't dare. It's rather the owners with aggressive dogs are not aware of and just open towards diagnosing therapeutic options. Well, you said also you even don't have to touch at the cat. Yeah, I had the tags in the basket. Yes, if you put the foot plates in the basket, usually they stand there because they feel how relaxing this is. And cats are more sensitive than ourselves, similar to horses. So it's really works very well. Well, we can say it works. Just dare to it. What do we have next? Can you also, for instance, use cows and pigs treated with bioresonance after, according to Paul Schmidt? Why not? I wouldn't have any problems with that, because the therapy programs can be done through fresh water, and since they are usually kept together, and in pigs you have problems in the whole stable, Probably it's useful also with cattle. If milk cows have pathogens in the udders, that will be a very specific thing. Of course, there are cases where the animals have a name and want to be treated individually. They can also do it. They even enjoy it outright. I know you are specialized in small animals, so you're from milk research. Well, so cattle is familiar to you, yes. Well, third question. Same thing. Antibiotics in massive stock keeping leads to resistances. Can the bioresonance therapy be used to replace antibiotic combinations? Definitely yes. And I think they can be help to reduce them, even replace them. And we said before that through water we can do it for the different pathogens. It's very advantage. And if we just do it for a water bottle or a big tank of how many liters, regarding the effect, it's the same. And finally, in pet practices are different. So whether patient is large or small, bioresonance doesn't take on kilograms, but also same thing with giving homeopathic medicine. It's not based on weight. It's that it is given, and the organism is able